Doug is the CEO. He's co-CEO, actually, and co-founder, and he joins us head of the opening trade. Doug, it's always great to see you, and I want people to understand right from the get-go that your company not only is growing like a weed, but is growing profits like a weed.
Thanks, Jim. It's great to see you again. You're an inspiration for so much of what we do, actually, so it's great to reconnect.
Well, one thing I want people to understand is that you're a company that brings down the price of drugs. I happen to have an experience how I know Doug is that I was paying $5,000 a month for a drug that I had to have. I found GoodRX, and they cut it to $1,000 a month. I still don't know how they did it. They do it with scientists. They do it with algorithms. Could you please explain to people, Doug, how you could save someone $4,000 a month on a drug that, by the way, was generic, but it had a particular casing that made it so it was so-called proprietary?
Yeah, Jim, it's just insane, right? I mean, the healthcare system in this country is so broken, right? Why should any American have to pay $1,000 or $6,000 or in some cases $2 million for a drug? And what GoodRx does is we just try to get Americans the care they need at a price they can afford. We've been doing that for over a decade now. It's worked out really great because it turns out our healthcare system needs so much help. And we're happy to be there to just help drive savings and give people the information they need so they can be informed consumers just like in any other industry.
Let's talk about the idea also of your app, which is what, the most downloaded healthcare app. I'm going to have to hype it because it's fantastic. But this is something that a lot of people who have expensive drugs know to download.
Yeah, I mean, it's super easy, right? Consumers just come to GoodRx, they download the app, they type in the name of their drug. We even help them spell it. And then we show them prices at pharmacies nearby, and the prices vary tremendously. It's super easy to use, and if there's a discount that works, you just show it to the pharmacy. We also do telemedicine as well. We provide telemedicine services so you can see a doctor online and get a prescription even sent to your house. It's so easy, and that's what we're most all about, really.
You know, Doug, a lot of people felt it's too good to be true. You get a coupon, you go to CVS, they honor the coupon, but they do.
That's the goal, right? Is to have a business that works right and helps people save. And that's what we've always been focused on, honestly. I mean, my greatest pleasure working at GoodRx is we're just a patient-first organization. We've always been that way. We want to reward our shareholders. We want to reward the amazing people that work here. But we're always focused first and foremost on what's best for the American patient, who honestly these days really needs help.
Well, I think it's important in an era of tremendous cynicism that because of your patient focus, which, by the way, is the same focus that Mark Benioff has at Salesforce, and because you're using your business as the greatest platform for social change in the healthcare business, that you actually can make a lot of money being good.
Yeah, I mean, it's this incredible flywheel that we have where, you know, the better we do as a business, that means we're helping more people. You know, we help over 18 million people a month. Over 18 million people at GoodRx have found savings and basically filled a prescription they otherwise couldn't have afford. 15 million people a month come to GoodRx to find savings. We do, over 1,000 telemedicine visits a day. These are all real people that need real help that are making hard decisions about whether it's rent or healthcare. And it's just been such an honor to be able to work at a place where, we can help people and, again, have this very successful business doing it. I also just wanted to mention, Jim, one of the things we're doing as part of this IPO is we're launching a new philanthropic initiative called GoodRx Helps, where we're taking over 1 million shares from this IPO and dedicating it to the neediest, to the people who, even with GoodRx, are not finding savings. And we're going to have basically a very big focus on trying to help people who just simply, even with GoodRx, can't find the help they need, working with clinics across the country.
Are there people who don't understand that they may be overpaying who should right now go to GoodRx and realize that perhaps they can get considerable savings, as I did?
Yeah, I mean, it's amazing. People ask us about competition, and our competition is people who just think the old way still works. People who think that insurance card in their pocket is all they need. And it turns out that it's not. And, look, insurance is paying for less and less, and prices keep going up for everything. And we're just here to educate people and give people the resources they need so they can be smart consumers. We're so proud that we've saved Americans over $20 billion since inception. Honestly, this is the blessing of my life that I get to work here with these incredible people. And, yeah, we just want to help more Americans find the care they need at a price they can afford.